After being removed, the donor tissue is carefully trimmed under microscopes into naturally occurring 1, 2, 3, and 4 hair follicular units. The surgical technicians use great skill to carefully avoid severing or transecting the hair follicles while creating these tiny grafts. This process is very labor-intensive, but it significantly improves the number and quality of hair follicles that can be produced from a limited amount of donor tissue. To produce large numbers of tiny follicular unit grafts typically requires an experienced team. Because this procedure is so demanding, few clinics perform it successfully. While the technicians continue to create grafts, the balding area is prepared for surgery. Once the recipient area is given local anesthesia, tiny incisions are made in an irregular pattern that mimics nature. The angle and direction of these incisions are critical as it determines the direction these hairs will grow. Fine one-hair follicular unit grafts are gently placed at the front of the hairline. Then, further back into the hairline zone, some 2 hair grafts are intermixed. Behind the hairline, the density of transplanted hairs increases, as does the number of hairs in each follicular unit graft. Typically, the grafts in the top and middle contain 3 and sometimes 4 hair naturally occurring follicular unit grafts. Creating a natural distribution of hairs with varying degrees of density requires excellent surgical skills and artistic judgment.